My name's Emily Byl. I'm an occupational therapist based in Anchorage, and I created a private practice called Wellhaven Occupational Therapy. And it was in response to my experience working in Anchorage-based hospitals and learning more about the Alaska healthcare landscape. Occupational therapy is one of those things, if you're not involved in it, many times it's difficult for people to know what it is. So I'll first start explaining in a nutshell what OT is. And so occupations, our life is made up of occupations, and these are our meaningful everyday activities. That includes roles you have. So whether you're a parent, a grandparent, an artist, a cook, and all the tasks that accompany these roles, we generally don't think about our daily occupations until we have trouble doing them. And that's where OTs come in. So if you have a medical condition or your health status changes, maybe you're recovering from an accident or an injury, those everyday activities are impacted. And so occupational therapy steps in and we work on those occupations in prevention programs, wellness, and rehabilitation, which most people are familiar with the rehabilitation side. OTs work with people across the lifespan and help them participate in things they want to do and need to do through the therapeutic use of those everyday activities. So we always are focusing on function. So for example, many times if you have a total joint replacement, then it's like you may have fallen, broken your hip, you have this replacement. An OT will help you figure out, okay, how am I going to get dressed on my own? How am I going to get to the bathroom, bathe, all of those things that were probably you didn't even think about before you had your injury. Now you have someone helping you through that who knows, the anatomy, physiology, and also the mental steps that you need to go through that. So yeah, so let me share my screen. So today I'm focused more on how we use telehealth to support people with dementia and their caregivers in everyday life and how we can make this work for Alaskans. So like I said, I created Wellhaven in response to working in Alaska's healthcare system. I'm originally from Michigan, but have been in Alaska for almost 6 years. And just seeing kind of where the gaps in care are. For example, I worked in an acute care setting and noticed that particularly older adults, discharge planning was very difficult. The things I was used to in Michigan, we have skilled nursing facilities, we have acute rehabs, we have any type of assisted living and memory care you could think of, we have it. And moving to Alaska and realizing that was not the case was a huge eye-opener for me. So we'd have patients who they would be discharged home with family caregivers who were not in healthcare and really had no idea what to do. We're very overwhelmed. There is little to no support prior to discharging from the hospital for those caregivers. To me, it seemed kind of like a good luck situation. We hope it works out. Another aspect of that was if they didn't have family that could become caregivers, we had very long hospital stays trying to find placement, which for someone with dementia, anytime you're admitted to the hospital is extremely confusing, let alone if you're there for weeks on end because we're not sure where you can go. We're trying to find funding for you or placement and your family isn't able to caregive for you. So these things just really stuck with me after that. And when I worked with a lot of older adults who didn't live in the Anchorage area, didn't live in the valley, or if they did live in the valley, they were too rural to make it feasible to attend an outpatient clinic. Many of them lived in places that there was non-existent to have outpatient occupational therapy, and we know that the majority of people with dementia will be cared for at home. It's about 70 to 80%. So We have people who are becoming caregivers, kind of a lot of times thrust upon them, that might not have the education of the disease or the knowledge of how to take care of someone with dementia. And so those are some challenges that I witnessed myself. And just through my research have found that, and right now an estimated 8,500 seniors have Alzheimer's disease and related dementias in Alaska. More than 1,000 residents are on the wait list for senior or disabled housing. And although there are a couple memory care facilities opening in Anchorage, which is wonderful, the majority will be staying at home, whether that's funding issue or family desire to keep them at home. So families and other informal caregivers are going to continue to be the principal source of support. And caregivers need support themselves, and they require knowledge and skill building to take on a very large task. So my piece of the puzzle to filling this gap is the Skills to Care program, delivered via telehealth to Alaskans throughout the state. This is a program that was created by OTs, some professors at Thomas Jefferson University. It's evidence-based. They tested it in randomized controlled trials and found that when caregivers and patients who have dementia went through it, it resulted in enhanced caregiver knowledge, skills, and well-being, reduced caregiver burden. The caregiver didn't have to provide as much assistance to the patient, reduced behavioral symptoms, and increased patient participation in activities. So this program, it was designed to be completed in a patient's home, but I'm adapting that program to be delivered via telehealth, because for me, that makes the most sense for Alaskans. And it's the only way a lot of people are even going to be able to obtain this kind of service. So it's a program that's delivered by OT specifically as a part of a plan of care. So it can be provided via home health, which is a Medicare Part A program, or outpatient, which is Part B. And so my private practice is outpatient. So this is a covered service by Medicare Part B, which also helps expand access to this service. The program runs between 6 to 8 weeks, and we meet via Google Meet once a week. And it really depends, it's custom to each person's needs. So it depends on how much caregiver support and knowledge and skills training they need. But it helps caregivers understand why certain behaviors occur. And it's not, we don't say it's because they have dementia. They're following you around all the time, or they're repeating questions, or they're getting aggressive. We don't say it's because they have dementia. There's always a trigger behind it. There's a reason why someone's acting fearful, or that they're being aggressive, or that they're refusing to bathe. So the theory behind Skills to Care is that the behavior is actually a function of the person with dementia and their interaction with their environment and their caregiver. And so it takes into consideration the person with dementia as a whole. What are their medical diagnoses? Because generally they have more going on than just dementia, typically. What other health conditions are happening? Is there a UTI? Are they experiencing pain? Maybe they're experiencing depression. What types of medication are they on that could be causing some of the symptoms that we're seeing? And what about their internal state? Are they having fear? Are they confused? Is there a sense of loss of control? So we look at the person with dementia as a whole, and we think about them and think about what is going on with them physically, mentally, and emotionally, and what can we address to make things work more smoothly at home. And then the next piece of it is we look at the caregiver. We look at their communication approach with the person with dementia. Do they raise their voice? Do they use negative comments? Are they giving too many directions at one time? things that might make it overwhelming for the person with dementia, and their management style. And what I mean by that is when they're doing daily tasks, are they breaking it down into small steps for that person, or are they overwhelming them with the demands of the task? Is there a predictable daily routine? Because that is a very comforting thing for it to know what's happening next, or not to have each day be different. That causes anxiety. And what are the caregiver's expectations of the person with dementia? Are they too low? Can we say, you know what, I actually think she can get dressed by herself given the right cues and the right setup? Or is it too high? You know, like, well, she used to be able to make herself breakfast and I just don't have time for that. You know, we have to come to a point where we can educate them about where the person's at now, and also provide them the education. Like, we know this disease progresses, so this is where they are now. This is what they're able to do. Because we know if the expectations are too high, everybody's frustrated. And then we also look at the caregiver stress level. So part of the Skills to Care program, we do a depression screening for the caregiver, because that's a huge problem with caregiving. Most of the time, their health gets put on the back burner and their life gets put on the back burner. So if it's appropriate, we'll do a depression screen. We also do a physical therapy screen for the person with dementia and their caregiver, and just because they're usually having to help them physically, and we don't want them to suffer an injury and then not be able to continue what they want to do and also care for their loved one. And then we direct them to the right resources as necessary for those pieces. And then lastly, the program takes into consideration the environment. We look at safety first, obviously. Are there fall risks in the home? How are they able to get on and off the toilet or in and out of the bathtub? Can they walk around the home without tripping on something? Is there good lighting? Is there too much clutter on the countertops or in the bathroom that is overwhelming and confusing? What about noise? Is the TV on all the time? And are there things for the person with dementia to do, appropriate activities in their home that they can do? Or is it mostly their options are watching TV? So those are the things that we look at. So this is the process of the program. It starts with the assessment. So like I said, the initial evaluation and the subsequent visits are done via Google Meet. So the patient and the caregiver, they don't have to download anything on their phone. They can use a home computer or a cell phone, which I wanted to make it as easily accessible as possible. Granted, they do need cell service. So that's one thing. I haven't run into it yet, but I know for some people in villages, they may have to go to the school where there's Wi-Fi or things of that nature, but I haven't run into that yet. But I know that that could possibly be a barrier. The assessment looks at the caregiver's problems and needs, and it also looks at their readiness for change. So some caregivers might be ready to go. They're like, I need the help. I'm willing to try out some different things. And that's wonderful. And then we can kind of go step by step through the process. Other caregivers who they're not there yet. They feel like they've tried everything. They might have, unrealistic expectations for that person, but for the person with dementia. But in that case, I'm there to provide more education and focus more on their ability to see, okay, the patient's abilities, but also know where the progression is, what may happen next and how they can be prepared. And the goal is that the more education they receive, they start kind of opening up to maybe some different suggestions and ways of doing things that can make their life easier. We look at caregiver management, communication style, like I mentioned before, and the home environment. The next part is teaching. So we teach caregiver stress management techniques from the beginning, because we want to get those initiated in every session so it becomes more second nature for them. The caregiving for someone with dementia is extremely challenging. And a lot of times caregivers are never even asked, like, how are you doing with this? So it's our way of really asking them and listening and validating what they're going through, but giving them tangible techniques that they can do to help with their stress levels. We take a problem-solving approach to what they're dealing with, and we brainstorm to develop strategies together. So for instance, if somebody, I'm going to show like an action plan on the next step that will be clearer, but they may say, well, this person, my father always gets agitated when I'm making dinner, and I feel like I could never make the right thing for him. And we kind of talk about, like, well, is it only dinner? What time of day does he have agitated behaviors? When does it not happen? What has worked in the past? So we work together to brainstorm strategies in the way we communicate with that person, in the way we set up the environment, in the way we set up the task. So the caregiver is part of the process, because this is how they're going to build the skills to address more issues in the future. We want to have them be able to see a new problem, and they're not going to have to call us up and we're going to have to figure it out. They're going to be like, okay, this worked for this situation, I'm going to try it for the next one. So, and that comes with the practice. So we have customized action plans that we practice together. We reinforce strategies to minimize negative behaviors, and promote activity participation. So I'm going to show you one of those action plans. It's very clear. So this is an action plan for bathing. So it's pretty black and white. Like, we have the description of the problem. My father won't bathe. He says he took a shower yesterday. He didn't take a shower yesterday. He won't do it. He refuses. It's getting bad. So we write down the caregiver's version of the description of the problem. And then we talk about why that problem might occur. He might have trouble regulating his temperature, so he doesn't want to get wet and cold. And that's a huge issue with older adults. He may not remember how to bathe. And I think sometimes we think that, and this goes back to the expectations, he might not understand what is being asked of him. So there's a refusal there, because if you say, you have to bathe, well, what does that mean? And some of these things get lost in translation when you have dementia. It could be feeling fearful, scared of falling, not knowing what to do next. There's many different reasons. So with each person, we kind of pick out, well, what do we think is going on here? And then we detail, how do we want the problem to change? And this is for the caregiver. It might be, if he could just shower once or twice a week, that would be fantastic. So we want to see, like, what does the caregiver see as a solution? What would make this not a problem anymore? Bathing once or twice a week? Okay. If it's bathing every day, we might have to talk about, the reality of that. That might not be something that's possible. And then we go to strategies. So simplifying the way you communicate. And we can check off the specific ones that we think will benefit the person with dementia. So providing 1 or 2 step simple verbal instructions is huge. A lot of times it's like, okay, Frank, you have shampoo, you have conditioner over there. Actually, you have 2 types of shampoo. Which shampoo do you want to use? Okay, just put some in your hand and wash your hair. That's way too many instructions. You might just grab the bottle, put some in his hand, say, Frank, wash your hair, because that's what he can process, and then they can respond and do that action. And I notice many times that's a big deal. It's like there's too many people talking in the room, or too many instructions, and then it's like, I don't know what to do. So there's, and then also part of it is just allowing that person to process the information you gave them and then do the action. They can't respond as quickly as they used to. So you need to kind of wait and see. So that's something about the communicating, modifying the home environment to make it safe. Only put out the necessary items is another huge one. If there's a bunch of different products all over the bathtub, they don't know which one to pick. So if you just have, maybe you just have like a 2-in-1 hair shampoo and conditioner, just one bottle, one bar soap. It makes it a lot easier because they know.
Emily, this is so meaningful to me personally. I just can't thank you enough. I'm noticing we're wrapping up on 1:30. I can see in the chat that there are so many people here that want to ask you questions. What is a good way to help you as a community?
Okay. Do you mean like getting the word out or?
Yes. Oh, okay. Or I can see, we've got Pam Kelly that wants to connect with you. She's with Alzheimer's Resource of Alaska. I can only imagine that you are probably going to be inundated with requests. So, what's a way to kind of leverage you and see how we can work with other organizations or?
Yeah, definitely. Okay. So this kind of gives you an idea about the action plan. Sorry, I get really excited about this stuff. So
awesome.
As you can see, I get into it. So let me go back to my thing. Okay. So then we teach the things, we generalize it so they can do it to other situations, and we measure outcomes as far as the caregiver's ability to be confident in their skills and stuff. So moving on. So we're looking ahead. We know that the population of elders with dementia is going to increase by, I think, supposed to double in the next 30 years. So we know this is coming. The Ivy's bill, I don't think is the same. I'm not sure if it's the same as the Expanded Telehealth Access Act. I don't know if Ivy's is for Alaska solely, but that's something that is huge because Medicare has, expanded coverage for OT via the public health emergency, but that's going to expire. So anytime you can write Congress or support Ivy's bill that we can make telehealth occupational therapy permanent, that'll be huge. And then helping me spread the word, because I really want to build enough. I want to show that there's enough need because I want to grow and get more OTs certified in this. I'm the only one in Alaska and we need more. We definitely need more. So if you could help me spread the word so that we can get referrals and I can build, then I can help other OTs get certified because it's not a cheap certification. So, obviously it costs money to get certified and then get the technology in place. So if anybody has ideas of how to connect also with some of the Alaskan villages, I think would be really helpful for me. That's kind of an area that I've had a hard time finding who to contact for, like the Indian Health Services, so that I could, maybe it's not reasonable for them to go through the 6 to 8 week program, but what can I do to provide some education for people in those communities? So if anybody has any ideas, that would be super helpful for me. But other than that, that's kind of the program in a nutshell. And do you want me to, I didn't read any of the chat. Do you want to read them, Jacqueline, or?
Sure. I'll invite people to unmute at this time. I'm sure there might be questions, and I'll read the chat very quickly to see if there's any questions. I don't see any questions, but I really have a few. I'm wondering, how are people responding to the telehealth services? Like when you're introducing this, I mean, the pandemic made it kind of obvious, but is there any pushback when you try to do this?
I get both. Sometimes there's a little pushback. They'd rather have somebody in person, but it's just not feasible. But there are many times they actually prefer it because sometimes the patient with dementia is not amenable to having somebody in their space. So I'm working with somebody in particular who her father has vascular dementia, and he would not let me in the home. So there's no way that would even work. So in a way, it's been helpful because then I can talk with the caregiver without causing any more upset to the person with dementia. But I think right now, because people are so used to it after 2 years, I haven't had a lot of blowback from that. No.
That's great to hear. Is there anybody, I love to hear that. I love your example of the person who really prefers the telehealth care. I think that's really important to point out. So may I ask if there's any other questions?
Yeah, I had a quick question. Thank you again, Jacqueline, for having me. Emily, thank you for the great presentation. Curious around the correlation. My name is Trevor Wilkins, by the way. Work for a healthcare innovation hub out of Los Angeles.
Okay.
Yeah, so we work with a lot of digital platforms. I was just curious, in terms of outcomes correlating with your telehealth, have you seen like improvement? Have you seen kind of like, the same as you would have seen before, or how has kind of telehealth helped your outcomes?
Well, what we do is we measure a few things: is caregiver upset in certain areas. So at the beginning, they rank their the amount of upset they have with bathing or toileting or what have you, and then their confidence to be able to address that. And then we do that at the end. And so far, I've only seen positive outcomes where they feel more confident in their ability to take care of the older adult. And they're not as upset by it because they know how to address it. I don't have my numbers yet because I'm still fairly new. So that's something I'm collecting. And there's an OT I'm working with in Pennsylvania who we're thinking about doing some research on this program delivered just via telehealth, so we can have even more support for it.
Okay, awesome. That was really kind of one of my main questions. We have a couple of other platforms in our network that work with this population. I'd drop my information in the chat, but would love to connect offline as well.
Perfect. That'd be great.
I will definitely connect you both. Thank you, Trevor. Pam Kelly is asking, at what stage in illness trajectory do you think this is particularly beneficial for persons living with dementia and their care partners?
Yeah, I mean, honestly, I think all stages. I think it's helpful because it's at least starts, if their loved one is very early in it, we're starting to give them the education and skills from the get-go, that they can understand maybe why the person is behaving the way that they do or having trouble with what they do. And they can start building those skills because it's a skill building program. So I think if they are starting to notice certain things about their loved one that are changing and they're not sure how to address it, I think that's a perfect time to start. I think, even if they're years into this, it's still beneficial because they're going to learn different ways to address what they're dealing with. And as we know, this is progressive disease, so things change. So we want to make sure that they have the resources and the skills in place to manage those. And also we're screening them for depression and physical therapy needs and their issues. So we're also looking at the caregiver as a person, making sure they know how to create time for themselves so they don't get lost in the job of caregiving.
Really important. I really appreciate the way that the caregiver, the fact that you also do an assessment of the caregiver is just outstanding. I do think that they get backburnered and they backburner themselves as well. So it's really important to put them in the focus. So we're out of time. I'm willing to stay on. And if anybody has any other questions, please let us know now, or if you'd like, I can connect you with Emily